In the world of medical diagnoses, some conditions sneak up slowly, disguised by seemingly unrelated symptoms, while others make themselves known through sudden and unmistakable signs. Chronic myeloid leukemia, CML, a type of cancer that originates in the bone marrow and leads to the overproduction of white blood cells, is one such condition. For many, its onset is insidious, and by the time symptoms surface, the disease has often progressed. This is a story that illuminates the subtle yet urgent nature of CML, while also exploring the transformative impact of modern medicine on the treatment of the disease. It began with headaches, recurring, throbbing pains that showed up like clockwork each day. These weren't the debilitating migraines that often leave people incapacitated, but a distinct, nagging discomfort localized on one side of the head. The sensation was hard to describe, a sickly, lingering ache that seemed more than just a tension headache or sinus pain. As is often the case with health issues, it was easy to attribute these headaches to everyday stress, lack of sleep, or dehydration. The first inclination wasn't to see a doctor, especially since the pain could be managed with over-the-counter medication. But the headaches didn't go away. They became a daily fixture, always arriving at the same time, signaling that something deeper was wrong. Accompanying this discomfort were night sweats, something most people wouldn't immediately link to a serious illness. Sweating during sleep is often dismissed as a minor inconvenience, perhaps a result of room temperature or a heavy blanket. Yet these night sweats were different. The sheets were drenched, not just damp but soaked through, so much so that they affected the entire bed. Sleep was constantly disrupted by the need to change sheets, a routine that, at its worst, could happen multiple times a night. Despite these symptoms, it can be difficult to connect the dots. Chronic myeloid leukemia doesn't announce itself with one glaring symptom, but rather with a combination of signs that are easy to overlook or explain away. When isolated, night sweats, headaches, and fatigue may not seem alarming. But when they persist and worsen, they become harder to ignore. Soon came the bruising, another symptom easy to rationalize. Bruises appeared on various parts of the body, large and colorful, as though caused by significant impact. Yet no such impacts had occurred. The bruises seemed to form without reason, almost spontaneously. This kind of spontaneous bruising is often a red flag, indicative of underlying blood or platelet issues, and is one of the hallmark symptoms of leukemia. But without knowledge of what to look for, it was tempting to brush it off as an odd but harmless occurrence. It was only after months of these strange and worsening symptoms that a visit to the doctor became unavoidable. A routine checkup revealed something even more alarming, a dramatic and unintended weight loss, something unnoticed until stepping onto the scale. In the span of months, there had been a significant decrease in body weight, an undeniable sign that the body was struggling with something far more serious than stress or minor illness. The doctor's reaction was measured. A full list of symptoms was presented, and while nothing immediately screamed cancer, there was enough cause for concern to order blood tests. Routine blood work is often where leukemia is first discovered, as the disease dramatically alters the balance of white blood cells, red blood cells, and platelets in the body. In this case, the test results were nothing short of shocking. An abnormally high white blood cell count, far exceeding normal levels, signaled that something was critically wrong. At this point, the situation escalated. When leukemia enters the conversation, fear and uncertainty quickly follow. The emergency room becomes the next stop, and further tests confirm the worst. Chronic myeloid leukemia had entered its accelerated phase, where the disease becomes more aggressive and difficult to treat. The diagnosis was clear, and it was delivered with the gravity it deserved. In the span of just hours, a previously healthy life was turned upside down by the sudden realization that cancer had been silently spreading within. For anyone who receives a leukemia diagnosis, the days and weeks that follow are often a blur of medical interventions, hospital stays, and a barrage of tests. In the case of chronic myeloid leukemia, treatment options depend on the stage of the disease. For many patients, the introduction of targeted therapies in the early 2000s revolutionized treatment. These drugs, particularly those that target the abnormal protein responsible for the uncontrolled growth of white blood cells, offer a path to long-term survival that was unthinkable just a few decades ago. The most famous of these drugs is one that has been hailed as a miracle drug for its effectiveness against CML. Before its introduction, the prognosis for patients was grim, with survival rates drastically low. But for some, even this life-saving medication can have intolerable side effects. The body's reaction to chemotherapy is unpredictable. What works for one patient may prove detrimental to another. In this case, severe side effects made it impossible to continue with the initial treatment, forcing a change in strategy. This is where modern oncology shines, providing multiple treatment avenues for a disease that, in the past, had very few options. After trial and error with medications, a second option proved more successful. With the introduction of a newer drug, the body responded favorably, and what had seemed like an insurmountable challenge became more manageable. The journey to remission is never straightforward, but with the right medication, the outlook for chronic myeloid leukemia can be positive. Treatment doesn't come without its challenges, though. Even when a patient is in remission or experiencing reduced symptoms, the ongoing nature of leukemia means that vigilance is required. Blood tests become a routine part of life, as do careful management of drug dosages and constant monitoring for side effects. The long-term use of powerful medications often leads to a delicate balance between managing the disease and managing the quality of life. For those living with chronic myeloid leukemia, the experience can be a roller coaster of physical and emotional highs and lows. The fear of relapse is always present, as is the reality of living with the side effects of medication. But for many, the outcome is far better than it would have been in previous generations, thanks to the incredible strides made in cancer treatment. The story of chronic myeloid leukemia is one that reflects the broader story of cancer treatment in the 21st century. It is a story of hope tempered by challenge, of medical breakthroughs that have transformed what was once a death sentence into a manageable chronic condition. But it is also a reminder that symptoms, no matter how minor or seemingly disconnected, should never be ignored. Headaches, night sweats, unexplained bruises, and weight loss might all have benign explanations, but when they persist, they warrant attention. In the end, it is the combination of personal intuition and medical expertise that often leads to early diagnosis and better outcomes. The decision to visit the doctor after months of symptoms, the insistence on blood tests, and the willingness to confront a terrifying diagnosis all played a role in turning this personal story into one of survival. Chronic myeloid leukemia is a complex disease, but with early intervention and the right treatment, the prospects for patients have improved dramatically. For those experiencing unexplained symptoms, it is a reminder to listen to the body's signals and seek medical advice when something feels off. The road to recovery may be long, and the journey may be fraught with difficulties, but with modern medicine and a proactive approach, there is light at the end of the tunnel. This journey of diagnosis and treatment is a testament to the resilience of the human body and spirit, and to the incredible advancements in cancer care that continue to give patients with CML and other forms of leukemia a fighting chance. If you or someone you know is experiencing persistent symptoms like headaches, night sweats, unexplained bruising, or weight loss, don't ignore them. Your body might be trying to tell you something important. Early detection can make a world of difference, and modern treatments offer hope where there was once none. Remember, it's always better to be safe and check in with your doctor. Thanks for watching, and if you found this video helpful, don't forget to like, subscribe, and share it with others. Stay informed, stay proactive, and take care of your health.